Hi, it's Dr. Janowski for Sonata. There's two things I want to talk about today. One is Dysport for migraines, or Botox for that matter, or Dysport or Botox for jaw clenching. Okay, sometimes those two things are related. People have headaches. It could be the clenching could be partially causing the headache, or it could be just a completely separate thing where patients suffer from migraines. And we know Botox does have an FDA approval for migraines. Remember, if you were to try to go get Botox for migraines, get it paid for by insurance, a couple things to remember. One is it's a lot of Botox. It's about 150 units. And if that weren't covered, it would be very expensive because that protocol requires Botox to be injected in the front and also down the neck. Okay, so that's a lot of product. And in order to get it covered, you typically have to go to a neurologist or someone who's approved to inject it for that purpose. And then you have to have at least, I think it's 14 headache days a month, which is, every other day. So it can be hard to get it approved. So I end up doing a lot of Botox or Dysport for migraines simply because we often use a lot less than the migraine protocol and still get good results, and we're able to spend less money on it because it's not going to get covered by insurance. And so there's lots of different ways to do that. Very often patients who get their typical cosmetic Botox or Dysport in the glabella, the forehead, the crow's feet, they can just get results simply by doing the lines and wrinkles. And we have a lot of patients who report incidentally that their headaches are better even though they're not coming for treatment of the headaches. And others come specifically for the headaches, and we often do them in the same areas. One area that is outside the cosmetic areas is the temple, which we're going to do today because a lot of patients get headaches in that area, and it's not going to help lines and wrinkles, but it may help relax the muscle because migraines often have a muscle tension component to them. And that's really what the Botox or the Dysport is working on. Regarding the jaw, a lot of people grind or clench at night, some do during the day, and they get a lot of headaches, jaw pain, TMJ, and other symptoms. And it's very, very effective for putting Botox or Dysport in the masseter muscle, which is the chewing muscle right here. And we're going to do that today as well. It also has a kind of a side benefit of causing jaw slimming. A lot of patients will come just to see they have a wide jaw, partially because the muscle is big, and if we can shrink that muscle, we can give them a slimmer face, so they like that as well. And some people get both benefits. So it's not any different really than injecting Dysport or Botox for other purposes. I use the same needle, it's very fast, and I'll show you in a minute. I tend to use Dysport. It works just as well as Botox, and it tends to be a little bit less expensive. So I'll show you those areas right now. Okay, so just relax here. So we're going to put it in the temple, and again we're just going to put it in a few spots here. That's one temple, and here's another one. A little bit into the hairline. And then for the jaw, I'll have the patient clench. So let's turn this way and clench your jaw and relax. You can feel the bulge of the muscle, and then we simply put that in. This is about 60 units of Dysport. Clench again and relax. And 60 of Dysport is equivalent to about 20 of Botox. And so we'll do the other side. Clench and relax. Clench again and relax. So I want to feel where that muscle is bulging out. Use a very small insulin needle here. Clench again and relax. And that's it. So that took all of about a minute. So that's the treatment for both masseter hypertrophy, which is the enlargement of the masseter muscle, and at least one of the typical Botox or Dysport migraine areas, the temple. And if you're not sure if you're a candidate, please come and talk to me and we can discuss.